My paper is about early diagnosis and intervention in subclinical keratoconus, which is we are conquering cone in children. Keratoconus, as we all know, it is an inflammatory, bilateral, asymmetrical, progressive thinning and ectasia of the cornea, causing irregular astigmatism and defective vision. Corneal ectasia in children less than 18 years is the pediatric keratoconus. Incidence and prevalence. When we see it is 1 in 2000 in adults, whereas in children it is 1 in 625. What is pondering? What is more important in pediatric KC is that it has a very rapid progression. Also, it has many association like ocular and systemic, especially VKC, and presentation is at very advanced stage. Much more important thing is that it affects the quality of the life. Aim of the study is to determine the pediatric prevalence of keratoconus and to provide intervention to prevent the progression. Materials and methods. It was a retrospective analysis in children of age 5 to 16 years, done over a period of 10 years. It was approved by ethical committee. Chi-square test was used for statistical analysis. Criteria. Patients around the age of 5 to 16 years with astigmatism of more than 1.5 diopter cylinder who were uncorrectable with the cylinder power, and those who had normal anterior posterior segment were included. And those with active VKC, corneal scarring, strabismus, retinal pathology, cataract or any previous ocular surgery were not included in the study. After the initial assessment, according to the steep K values, they were segregated into 3 groups. Group A included patients who had a K reading of less than 47 diopter, B between 47 diopters to 53 diopters, Group C more than 53 diopters. Results. Out of 584 eyes, 36 eyes, which is 6% had keratoconus. Of them, 5 eyes, which is 13% required collagen cross-linking. In group B, out of 428 eyes, 78 eyes, which is 18%, and 20 eyes, which is 25% required C3R. In group C, among 153 eyes, 105 eyes had keratoconus, and 48 eyes required C3R at the time of diagnosis. Prevalence of keratoconus in all the groups like group A, group B and group C were statistically significant. Also the need for collagen cross-linking also in group A, B and C was significant. These are the results. Summary, in total of 116 eyes, 209 eyes are required keratoconus. I mean, diagnosed to have keratoconus. This group A had 6%, group B 18, group C 68. And from 209 eyes, 73 eyes required collagen cross-linking, which is group A 13%, group B 25, and group C 45%. After 2 years of follow-up post collagen cross-linking, 77 eyes showed flattening, 18% eyes showed stable K value, and 3% showed progression. Also, the mean K value changes from 56.34 to 54.75. So take-home message here is that screening of children with astigmatism more than 1.5 or a steeper K reading is important. Treatment is very time sensitive. A corneal collagen cross-linking remains the cornerstone to halt the progression. Stringent management specific to the disease state is very important. Thank you.
So, when do you recommend CTR surgery in pediatric kids?
Sir, when the presenting thickness itself is very less, sir, and they're showing progression of more than 1 in K reading in 6 months, or thickness of more than 5% loss in 6 months, we are recommending C3R, sir. Even the visual Snellen line loss of 1 or 2 lines, we are recommending C3R. In patients who are not having active VKC, sir, if they're having VKC, we are trying to treat them, making the eyes quiet, then only we are planning for the CH, sir.
You have done topography.
Yes,
so,
sir.
Any qualitative or quantitative data you are included in this study? Anything you are diagnosed on the basis of keratometry only?
The pathfinder value, sir.
Okay.
Based on the pathfinder KCN pattern, if present or not. How much percentage of pathfinder is showing KCN pattern?
And the progressors at the end of 2 years, and then,
Yes,
they
ma'am.
were belonging to which group?
Even after
So which group did they belong to? That you had not, I guess. They belong to the C group.
both mostly C group, ma'am. Also in A and B, also, ma'am. They had uncontrollable VKC, ma'am. Even after supratarsal tenocar, they had BKC.